Welcome to Healthcare Tech Talk, a podcast looking at tech talk with a twist. Listen in as our experts from Brillio invite leaders from some of the largest healthcare systems and companies across the US to discuss and share how they are transforming healthcare. It's a tech talk and real talk from the people who are working to transform and improve healthcare every day. Hello, everyone. I'm Avantika Sharma, the Global Head of Healthcare at Brillio. Let's get the show started. On today's episode, we welcome our very own Chander Damodaran, Global CTO at Brillio, and Hanna Aljaliss, who is leading our healthcare technology and life sciences practice at Brillio. Now let's know a little bit what Chander does. Chander is the Global Chief Technology Officer at Brillio. He's a problem solver, evangelist focused on bringing in the right mix of business and technical competency to solve significant business problems. He thrives in fuzziness and loves defining the blueprint for digital transformation with clear outcomes and elevate customer experiences. He has a computer science engineering degree and is currently a member of the Forbes Technology Council. Hanna Aljaliss is a distinguished technology and healthcare officer, an entrepreneur and thought leader with an illustrious career spanning more than 18 years in healthcare and life sciences sector. His expertise lies in guiding organizations to streamline the processes and technologies, leveraging AI, cloud computing, and process automation to drive innovation and operational efficiency on a massive scale. His keen understanding of the industry has led to successful execution of numerous projects impacting healthcare providers, researchers, payers, and patients alike. Wow, I am in the company of some really smart people. Welcome, Hanna and Chander, to this podcast.
Thank you, Avantika.
Thank you.
So today we are going to talk about something which is very exciting. Every second person is talking about it. Any guesses? Yes, it is generative AI. Generative AI has captured the attention of businesses and common people alike. It has fundamentally disrupted how we see AI in general and has removed generative AI from the realm of data scientists and innovation labs to the mainstream commercial use cases. Companies have been exploring how to embrace generative AI either through the hyperscalers like ChatGPT, Bard, MedPalm, versus developing their own in-house open source LLM models. So Chander, question for you. How do you see this evolving? And do you think that companies should have a perspective whether they should go with the hyperscalers and use ChatGPT and OpenAI to sort of catapult their innovation, or should they be looking at more building these large LLM models in-house?
Thank you, Avantika. I think that's a great question, so very pertinent in a market scenario that we are in today. Who knew, what is LLM, probably 6 months ago, right? Today with, I think with ChatGPT, that came out last November. Today, like you said, it's all very mainstream, right? It's everybody understands what is generative AI. Everybody understands what is large language model. And I think I was looking at a research. It talked about, the time that some of these, it's a social softwares, right? Like if you to think about Instagram, how long did it take before they hit the million users, right? The Chat GPT, if you take a guess, it took less than 2 months to kind of hit that mark. And that's the power, that this, software has had on businesses and enterprises alike. So what you asked is an excellent question, right? It talks about, should I embrace an open source based large language model, or should I look at more of a, what is available from these large hyperscalers? Now, if I were to answer this in, let's say, 2 levels, right? One, look at how, generative AI has captured the attention of businesses and common people alike. Now, the open source has had a very similar view, right? Like if I have to look at the open source as a terminology and kind of look at that from the lens of an enterprise customer, there is research that says, well over 80% of enterprises trust open source as they would trust a proprietary software that came from, let's say, some of the large, OEM softwares, right? So, if you take that lens and now you apply this in the context of generative AI, it should be a very straight fit where, open source, LLMs should be something that should be embraced by enterprises. But just to answer a little bit of the the way ChatGPT kind of caught attention, and then look at the generative AI overall, it revolves around essentially two important dimensions, right? The number of parameters that it can work with against, and the number of tokens that they consume to basically create these models, right? And there are different types of models. So there is, the transformers model, which is where your GPTs kind of come in. There are also these RRN models, which are, which run a slightly different model. But end of it, when you look at it, right, they're largely based on, some of the well-known ones, right? Like they're based out of Meta's Llama models, right? So a lot of the companies that have built these open source, like the likes of Alpaca, Vicuna, right? All of these have been built on top of this. Now, the interesting thing with all of these open source models, right, and there is many more, right? Like there's GPT for all, right? There are so many of these models that are out there, but they're all working on a smaller number of parameters, and they have lesser number of tokens that they're using, right, for their research. So essentially, they're good from a research perspective. But when you look at this from an enterprise adoption, and when you're looking at enterprise adoption, they're looking for scale, right? They're looking for resiliency, and they're looking for, you mentioned about MedPalm, right, which is very industry specific, etc., right? And that's where I would say the tilt for an enterprise customer is more towards embracing hyperscaler based LLM models, because one, they are industry grade and they are available for consumption with running on much higher number of parameters than what you would see from these research projects. And second, they're actually open for commercial use, right? Where most of the open source ones are actually not open for commercial use. So when you kind of look at it and you want to look at this from kind of maximizing this, the value that you're able to generate out of these models, I would say, the tilt would be to kind of choose the hyperscalers and go with their models. And especially with some of these industry models that are coming out from some of the hyperscalers, I think it makes the most sense for us to align ourselves around that.
Thanks, Chander, for the valuable insights. I do see, organizations that we have been talking to taking both the approach. I think it's the initial research phase. As you rightly mentioned, they are experimenting, some of off-the-shelf, generative AI solutions versus them sort of investing themselves and seeing how the use cases can come. So that's helpful. Hanna, you're the healthcare guru. I'm sure you're seeing a lot of demand on generative AI use cases within the healthcare space. Do you want to share your perspective about what are the type of use cases the peers and the providers are exploring?
Absolutely. Thank you, Avantika, for that question. And quite frankly, the possibility of generative AI in healthcare are vast. And we're living in a very exciting time as a technologist who is focused on this particular domain. I'll try to break down, the use cases into a couple dimensions. The first dimension is where are the applications apply in the healthcare ecosystems, and I'll focus primarily around the healthcare payer and providers. We'll talk about maybe life sciences at a different time because that's a whole new topic, and that has multiple dimensions as well. And the second dimension that I would like to cover is really, at what time period we expect those use cases to materialize, distinguishing between short-term, possibly 1 to 3 years from now, and long-term, 5+ years from now. So starting with the healthcare provider space, in the short term, we've already seen a number of large-scale providers, company in the industry, exploring and applying generative AI to address challenges such as physician burnout, primarily through automating various operational tasks in the healthcare delivery system, such as creating medical and clinical reports, summarizing patient history, and even annotating and codifying medical notes for billing purposes. And we've seen some early attempts to actually now to try to generate, for example, prior authorization requests directly by extracting insight from your medical EHR system or medical notes and stuff like that nature. So from a long-term standpoint, in the provider side, we anticipate some significant transformation where these large language models and generative AI become clinical brainstorming knowledge-based engine that physician can use to input information such as symptoms, medical history, or even genomic data, and start to use them to generate hypotheses about possible diagnosis and things that typically are not seen from looking at it from one dimension alone. These models can also help in generating insights about risk factors for medications, for various disease, and offer sometimes very personalized preventive measures and strategies for physicians. So that's on the provider side. Shifting to the healthcare payer standpoint, in the short term, we started to see the focus started to become on how do we improve and accelerate access to health-related information online. We understand, the healthcare system, and especially on the payer side, is heavy on information. So the idea of leveraging generative AI to empower patients for immediate access to information online can lead into significant cost saving, primarily, let's say, in the cost centers, and improving member experience, and also increase Medicare start rating for their health plans who are actually servicing Medicare members. So that's primarily the short term what we're seeing and stuff like that. And from a long term standpoint, the healthcare payer. Most healthcare plans and healthcare payers will start to see how they can harness generative AI on a more, core functions within their organization, such as adjudicating claim. Claim adjudication is probably one of the most significant costs for healthcare payers, and especially those claims who actually don't go through the straight through processing and requires a manual touch. Training and LLM models of how to adjudicate these claims and generate or make determinations on payment can lead into significant cost saving for them. The other area that we are also seeing some interest on and early exploration is really around core management and coordinations, where, in a healthcare delivery system, there are multiple entities involved, from doctors, hospitals, caregivers, facilities, and so on and so forth. And usually, to provide a comprehensive care management, you have to provide multiple coordinations, or you have to increase coordination between all these entities. Like, just to give you an example, like, a patient is discharged from a hospital, usually that requires multiple entities to be involved to provide the care that's required for that patient, to ensure that there is no readmission back to the hospital, because readmission is a major also problem in the healthcare industry. So how can we leverage generative AI to actually create a personalized plan, summarizing the reason for that patient to be in the hospitals and discharge notes, and then communicating with all the entities that needs to be involved in the care management and the care coordination to ensure that patient basically, on a fast for recovery, and we don't see readmission back for the hospitals. And lastly, in the healthcare system, in the healthcare payer system, I think preventive medicine is going to be really a domain where we're going to see tremendous opportunities for generative AI, especially around identifying different risk factors and diseases, and enabling payers to proactively reach out to these members, and then trying to kind of put some preventive measure in plans to actually prevent them from getting the disease in the first place. So these are generally the use cases that we're seeing in both the provider and payer space.
Wow. Those use cases can surely reduce the huge administrative costs that sits in our healthcare system, even if half of them get implemented. So that's super exciting. Yeah, I'm hoping by next year this time, maybe generative AI is going to start recording that podcast, Hanna, instead of you and me, probably. Who knows?
Yeah.
All right. So, Chander, when people these days are thinking about generative AI, the very first topic that comes to their mind is security. Is it safe? Specifically in healthcare, where there are so many regulations that are involved. There are HIPAA compliance. There's PHI and PII data involved. So, From that perspective, if an enterprise has to look at generative AI, how should they think about the security concerns that they have?
Great question again, Avantika, and this is probably a top question that almost everybody goes through. I have seen a lot of our customers basically, putting up guidelines, right? And especially after some of the initial users of the ChatGPT actually started putting out some of the company's internal data, right? Some of their private IPs onto ChatGPT. Now, again, this is a learning model, right? So you're essentially trying to feed it. It obviously becomes more smarter along the way. But I think what's important is, and especially in a regulated industry like healthcare, it's important to have the right checks and balances, and especially trying to maintain the privacy of the data and of course your overall IP, etc. I think becomes a very, very important dimension. So I've started seeing a lot of customers actually putting together, governance in place, talking about, what needs to, what can go or what cannot go onto some of these open, LLMs like, ChatGPT, for example, right? But I think when you look at this from the enterprise lens, one is to put together the governance and controls that is required, in terms of how the employees are basically kind of leveraging a technology like this. So obviously there needs to be controls in terms of what we are doing or what we shouldn't be doing. And obviously it's a strict no to basically put any of your company's IP or data onto public. But I think when you kind of look at this, and this kind of translates it back to one of the first questions that you asked, is how as an enterprise, right? Should I look at an open source? Should I look at a more of an hyperscaler driven? So in my mind, the way I look at this is, think about running with a private instance. And especially now with all of these hyperscalers, with the models that they're available, the paid models, right? And these models are available for you as private instances. I would suggest, that, as enterprises start to explore, because the benefits of what a generative AI can do, and especially Hanna, with the way you talked about a lot of the use cases, is so very relevant and so very impactful. In my mind, right, I think it may not even be the next year, right? I think maybe in the next few months, you will start seeing a lot of these being realized, which means firms need to, embrace this wholeheartedly. But at the same time, you can't let go of your security, which means looking at some of these hyperscaler provided LLMs, as a private dedicated instances. I would suggest, we should look at that as number one option. But also, a lot of the other concerns are also there, right? Like, some of the OpenAI, which is available on some of the hyperscalers, managed services. What happens, is this data, whatever I'm trying to input, is this within my corporate boundaries or is this going to be outside? There are also controls that you can put together, right? You can define like reverse proxies, etc. So all of those apply. But what fundamentally, is the fabric of an organization, right? In terms of the security posture, I think none of those should change, right? In fact, all you should do is, I don't know if very recently we saw almost like 100,000 of account credentials of generative AI basically being available on the dark web. So what it means is, your traditional controls as an enterprise, in terms of what you're doing from a security perspective, all of that needs to be strong, along with the governances that you're putting together, saying, what can go out into the public realm versus what shouldn't, and then trying to take a very strategic approach in terms of saying, how do we leverage the power of generative AI and realize some of the use cases that Hanna was talking about. I think it's important for you to kind of look at the hyperscaler provided LLMs and kind of converge this with a segmented security architecture, implement reverse proxies. All of these will ensure that you're able to generate, use the power of the generative AI, but at the same time, don't have to let go of your security control. So in my view, Avantika, these are some of the things that we should do as an enterprise, and especially in the healthcare sector, to kind of ensure that, we are able to realize a lot of these use cases using the power of generative AI that it has.
Thanks, Chander. Those were very insightful points that you gave our audiences. So Hanna, from your perspective, what would be your key message on generative AI for the audience who's listening in? It could be, some of the CIOs of these peer and provider organizations. It could be people like us, patients/members who are trying to get a little bit more insights on what does generative AI mean for me. So what are some of the key messages you would like to give them?
Great question, actually. So what I would say is, I think I'll go back to how you started this podcast with Avantika and say, well, get ready for a real disruptive impact. Generative AI is absolutely a significant inflection point in the AI research journey, and also the most significant step in over half a century that aim towards closing the communication gap between human and machines and trying to build systems that can potentially think and act like us. And that's significant. And while we are still at the early stage of this disruptive technology, we can already see all the potentials, specifically in the healthcare space. We all know, for example, that this one-size-fits-all approach in healthcare is outdated. And even physicians agree to that, because every person is unique in terms of their genomics, in terms of their lifestyles, their health data, their even social economic status. With generative AI, think about it, right? We're talking about building a custom-made, tailor-fit, just for you healthcare plan. It looks into patients' unique blueprints and craft a very personalized healthcare plan that fits like a glove. And that's significant in the healthcare space. And that's basically what we talk about as the future of personalized medicine, where generative AI is going to be the heart and center of that future. But going back to what Chander was saying, while we are all for having that personalized healthcare tailored systems or plan, we need to also remember that the importance of ethic and privacy and the considerations around that needs to come along. We also need to ensure that data is protected. We need to not end up perpetuating bias as we do delivery. So these are all things that needs to be resolved. And I hate to use the word hurdles, but things that we have to actually think about as we are democratizing generative AI in the healthcare systems. As they say, with great power comes great responsibility, and that's undoubtedly true about generative AI in healthcare. So as we step into this brave new world of generative AI in healthcare, it's really important to remember that the future of healthcare isn't just about digital and data. It's about creating and about understanding how to create human-like, responsible, and most importantly, tailored solution for our patients or for basically members and humans. Because at the end of the day, with great technology, if it doesn't actually create an impact on humans and how that translates into well-being and better future for them, then this technology become irrelevant.
Well, I love just for you healthcare. That's something that the healthcare industry in general has been aiming to get to, but if that's possible via generative AI, just love that concept itself. Well, thank you so much, Hanna and Chander, for being our guests today. Loved your insights, and thank you for sharing your valuable time. And for the audiences who's listening in, you can learn more about this show by visiting the program page on healthcarenowradio.com, and be sure to connect with me on Twitter and on LinkedIn. I'm Avantika Sharma. Thanks for listening. Healthcare Tech Talk is produced by Brillio. Brillio is a global leader in enterprise digital transformation solutions, providing strategic consulting and implementing digital solutions for Fortune 500 plus customers. You can learn more about the company at Brillio.com, and be sure to follow us on Twitter at Brillio Global.